My name is Bettina Hochreiter. I am a shoulder and elbow surgeon and consultant at the University Hospital Balgrist in Zurich, Switzerland. I'm the first author of a paper that was recently published in JBJS entitled Natural History of Quantitative Fatty Infiltration and 3D Muscle Volume after Non-Operative Treatment of Symptomatic Rotator Cuff Tears. We know that rotator cuff tears enlarge over time and that this enlargement is associated with the progression of fat infiltration. Now, we also know that the severity of fat infiltration predicts the outcome of operative and non-operative treatment. Therefore, accurate assessment of fat infiltration and knowledge about its natural history is pretty important for our decision-making process as clinicians. In our daily practice, most of us would probably use the Gutelier classification to help us in this process. However, the Gutelier classification is a subjective, single-plane, and qualitative grading system. Therefore, the purpose of our study was to quantitatively and longitudinally analyze mean supraspinatus muscle fat infiltration and its 3D volume. In addition to regular shoulder MRI sequences, we have been adding 6-point Dixon sequences for about 3 to 4 years now. Those can be used to quantify the fat fraction within a muscle on multiple MRI cuts. We measured fatty infiltration at the initial presentation of our patients in our clinic and after a 3-month minimum of non-operative management. We found that approximately 18% of shoulders that initially had normal fat infiltration of their supraspinatus progressed to advanced or even pathological fat infiltration. And in total, 14% of shoulders showed a relevant amount of progression of fat infiltration after a mean follow-up of a little more than 1.5 years, but in some cases as early as 4 to 5 months. Those results were somewhat expected, but what surprised us was that we were able to identify 3 risk factors for progression that can easily be quantified on basically every initial MRI. And those factors are equal or more than 20 millimeters of medial lateral tear size, 10% of fatty infiltration, and 17 millimeters of tendon retraction. Each of those critical thresholds led to a higher risk of relevant progression of fatty infiltration, but combining them led to a 91% chance of progression within about those 1.5 years. Tears that do not meet these cutoff values can most likely be managed without surgical intervention over a year with a high level of assurance. The indications for operative rotator cuff tear management still vary widely, and precise knowledge about the natural history of one of the main predictors for the outcome is therefore crucial when counseling patients with regard to optimal timing for surgical intervention, especially if a trial of conservative management is considered. Professor Wieser, the senior author of the study, and I would therefore encourage clinicians to talk to their radiologists, start adding Dixon sequences to their set of shoulder sequences, and use the identified risk factors and cutoff values in their decision-making process on the necessity of surgical treatment and the associated time frame. Thank you for listening.